Hello and assalamu alaikum everybody. Welcome to my YouTube channel. Today our topic is about most important nursing related MCQs. Which of the following is the normal range of adult respiratory rate? Options are option A 8 to 12 breaths per minute, option B 12 to 20 breaths per minute, option C 20 to 30 breaths per minute, option D 30 to 40 breaths per minute. The right option is answer B 12 to 20 breaths per minute. Which pulse site is best for assessing circulation to the lower limbs? Options are option A radial, option B brachial, option C dorsalis pedis, option D carotid. The right answer is answer C dorsalis pedis. The primary purpose of infection control measures is to options are decrease hospital cost, option B prevent the spread of infections, option C improve patient satisfaction, option D minimize antibiotic use. The right answer is answer B prevent the spread of infections. What is the recommended angle for intramuscular injection? Options are option A 15 degree, option B 30 degree, option C 45 degree, option D 90 degree. The right answer is answer D 90 degree. Which condition is a priority when administering oxygen therapy? Options are chronic bronchitis, option B hypoxia, option C fever, option D dehydration. The right answer is answer B hypoxia. What is the best site to assess for cyanosis in a dark-skinned patient? Options are option A nail beds, option B palms of hands, option C lips and oral mucosa, option D elbows. The right answer is answer C lips and oral mucosa. Which position is best for assessing jugular vein distension? JVD. Options are option A supine, option B semi-Fowler's, option C high Fowler's, option D prone. The right answer is answer B semi-Fowler's. In a patient with left-sided heart failure, which symptom is most common? Options are option A peripheral edema, option B ascites, option C pulmonary congestion, option D jugular vein distension. The right answer is answer C pulmonary congestion. Which assessment technique is used to detect ascites? Options are option A rebound tenderness, option B fluid wave test, option C Sosa sign, option D Morpheus sign. The right answer is answer B fluid wave test. A patient with diabetes mellitus has a fasting blood sugar of 210 mg per deciliter. What is the priority nursing intervention? Options are option A administer insulin as prescribed, option B encourage fluid intake, option C provide high carbohydrate snacks, option D observe for tremors. The right answer is answer A administer insulin as prescribed. A nursing diagnosis for a patient with pneumonia would be options are option A impaired physical mobility, option B ineffective airway clearance, option C chronic pain, option D risk for falls. The right answer is answer B ineffective airway clearance. Which nursing diagnosis is appropriate for a patient with severe vomiting? Options are option A risk for infection, option B deficient fluid volume, option C impaired skin integrity, option D risk for aspiration. The right answer is answer B, deficient fluid volume. A patient with colorectal carcinoma is experiencing constipation due to opioid use. What is the most appropriate nursing diagnosis? Options are imbalanced nutrition, less than body requirements. Option B, risk for infection. Option C, impaired gas exchange. Option D, risk for constipation. The right answer is answer D, risk for constipation. Which of the following intervention is appropriate for a patient with impaired gas exchange? Options are option A, restrict fluid intake. Option B, encourage deep breathing exercises. Option C, elevate legs above heart level. Option D, apply abdominal binders. The right answer is answer B, encourage deep breathing exercises. A patient with colorectal cancer is experiencing severe pain. What is the first nursing action? Options are administer prescribed analgesics. Option B, teach relaxation techniques. Option C, encourage activity. Option D, offer fluids. The right answer is answer A, administer prescribed analgesic. Which assessment finding is most concerning in a patient with a head injury? Options are drowsiness after pain medication. Option B, unequal pupil size. Option C, middle headache, mild headache. Option D, bruising around the eyes. The right answer is answer B, unequal pupil size. What is the most reliable indicator of pain? Options are option A, patient's facial expressions. Option B, increased blood pressure. Option C, patient's self-report. Option D, grimacing. The right answer is answer C, patient's self-report. A patient with fluid overload would likely exhibit. Options are option A, dry mucous membranes. Option B, crickles in lungs. Option C, low blood pressure. Option D, tachycardia and hypotension. The right answer is answer B, crickles in the lungs. Which sign indicates early hypoxia? Options are option A, cyanosis. Option B, bradycardia. Option C, restlessness and confusion. Option D, decreased urine output. The right answer is answer C, restlessness and confusion. Which electrolyte imbalance is associated with muscle cramps and tetany? Options are hyperkalemia. Option B, hypocalcemia. Option C, hypernatremia. Option D, hypokalemia. The right answer is answer B, hypocalcemia. Which nursing diagnosis is most appropriate for a patient with a pressure ulcer? Options are option A, impaired skin integrity. Option B, acute pain. Option C, imbalanced nutrition, more than body requirements. Option D, risk for falls. The right answer is answer A, impaired skin integrity. A patient with congestive heart failure has edema and dyspnea. Which is the best nursing diagnosis? Options are option A, ineffective airway clearance. Option B, decreased cardiac output. Option C, deficient fluid volume. Option D, risk for aspiration. The right answer is answer B, decreased cardiac output. A patient with colorectal carcinoma is experiencing diarrhea due to chemotherapy. The best nursing diagnosis is options are option A, risk for constipation. Option B, imbalanced nutrition, less than body requirements. Option C, risk for dehydration. Option D, acute pain. The right answer is answer C, risk for dehydration. For a, for a patient with pneumonia, the most appropriate nursing diagnosis is option A, chronic pain. Option B, ineffective airway clearance. Option C, risk for falls. Option D, social isolation. The right answer is answer B, ineffective airway clearance. A patient undergoing surgery expresses anxiety. What is the best nursing diagnosis? Options are option A, risk for infection. Option B, impaired verbal communication. Option C, anxiety. Option D, risk for bleeding. The right answer is answer C, anxiety. A nursing intervention for a patient with a nursing diagnosis of impaired physical mobility includes options are option A, encouraging bed rest. Option B, performing passive range of motion exercises. Option C, restricting fluid intake. Option D, administering diuretics. The right answer is answer B, performing passive range of motion exercises. Which intervention is appropriate for a patient with an infection? Options are option A, encourage frequent hand washing. Option B, decrease fluid intake. Option C, restrict movement. Option D, avoid antibiotic therapy. The right answer is answer A, encourage frequent hand washing. Which is a priority nursing intervention for a patient with hypoglycemia? Options are option A, encourage fluid intake. Option B, administer insulin. Option C, provide a fasting carbohydrate. Option D, monitor potassium levels. The right answer is answer C, provide a fasting acting carbohydrate. For a patient experiencing dyspnea, the nurse should first options are option A, elevate the head of the bed. Option B, offer high protein meals. Option C, administer IV fluids. Option D, decrease oxygen supply. The right answer is answer A, elevate the head of the bed. Which action should be included in the care plan for a patient at risk for falls? Options are option A, place the bed in the highest position. Option B, keep the call light within reach. Option C, encourage the patient to walk alone. Option D, keep the room dark. The right answer is answer B, keep the call light within reach. Which medication is commonly used to treat opioid overdose? Options are option A, morphine. Option B, naloxone. Option C, diazepam. Option D, atropine. The right answer is option B, naloxone. A nurse is giving digoxin to a patient. What should be assessed first? Options are option A, blood pressure. Option B, respiratory rate. Option C, apical pulse. Option D, temperature. The right answer is answer C, apical pulse. A patient on warfarin should be advised to avoid foods high in options are option A, vitamin D, option B, vitamin K, option C, vitamin C, option D, iron. The right answer is option B, vitamin K. Which of the following is a side effect of furosemide? Options are option A, hyperkalemia. Option B, hypotension. Option C, bradycardia. Option D, hyperglycemia. The right answer is answer B, hypotension. When administering an intradermal injection, the nurse should insert the needle at options are option A 90°, option B 75°, option C 45°, option D 15°. The right answer is answer D 15°. Which ethical principle involves keeping patient information confidential? Options are option A autonomy, option B beneficence, option C non-maleficence, option D confidentiality. The right answer is answer D confidentiality. What is the purpose of an incident report? Options are option A to assign blame, option B to prevent future errors, option C to report personal grievances, option C, option D to punish staff. The right answer is answer B to prevent future errors. Which of the following is an example of primary prevention? Options are option A blood pressure screening, option B immunization, option C chemotherapy, option D rehabilitation. The right answer is answer B immunization. The nurse notices a colleague giving the wrong medication. The best action is to options are option A ignore the situation, option B immediately report it to the manager, option C politely intervene and clarify the order, option D wait to see if the patient has a reaction. The right answer is answer C politely intervene and clarify the order. Which document outlines a nurse's professional responsibilities? Options are option A hospital policies, option B the Nurse Practice Act, option C patient medical record, option D insurance policy. The right answer is answer B the Nurse Practice Act. Which artery is commonly used to check an adult's blood pressure? Options are option A radial artery, option B brachial artery, option C carotid artery, option D femoral artery. The right answer is answer B brachial artery. Which assessment finding indicates early stage dehydration? Options are option A dry cracked lips, option B decreased urine output, option C altered level of consciousness, option D skin tinting. The right answer is answer B decreased urine output. In a patient with right-sided heart failure, which symptom is most expected? Options are option A pulmonary congestion, option B peripheral edema, option C cough with frothy sputum, option D coracles in the lungs. The right answer is answer B peripheral edema. Which assessment finding is most concerning in a patient with a burn injury? Options are option A hoarseness and difficulty in breathing, option B pain at the burn site, option C blister formation, option D increased heart rate. The right answer is answer A hoarseness and difficulty breathing. Which laboratory value is most concerning in a patient with chronic kidney disease? Options are option A serum potassium 6.2, option B hemoglobin 14 gram per deciliter, option C sodium 138, option D bicarbonate 24. The right answer is answer A serum potassium. Which nursing diagnosis is most appropriate for a patient with a history of seizures? Options are option A, impaired swallowing, option B, risk for injury, option C, impaired skin integrity, option D, chronic pain. The right answer is answer B, risk for injury. A patient with COPD has difficulty clearing secretion. Which nursing diagnosis is most appropriate? Options are option A, impaired verbal communication, option B, ineffective airway clearance, option C, risk for infection, option D, anxiety. The right answer is answer B, ineffective airway clearance. Which nursing diagnosis is most appropriate for a patient with uncontrolled hypertension? Options are option A, risk for falls, option B, risk for decreased cardiac output, option C, chronic pain, option D, fluid volume deficit. The right answer is answer B, risk for decreased cardiac output. A patient with a nasogastric NG tube for feeding is at risk for. Options are option A, dehydration, option B, fluid overload, option C, ineffective breathing pattern, option D, social isolation. The right answer is answer A, dehydration. Which nursing diagnosis is most appropriate for a patient with an open wound? Options are option A, risk for infection, option B, disturbed body image, option C, impaired verbal communication, option D, acute pain. The right answer is answer A, risk for infection. Which intervention is a priority for a patient with risk for aspiration? Options are option A, encourage supine position, option B, maintain head of bed elevation at 30 to 40 degrees, option C, restrict oral fluids, option D, provide thickened liquids only. The right answer is answer B, maintain head of the bed elevation at 30 to 40 degrees, 45 degrees. What is the primary intervention for a patient with urinary incontinence? Options are option A, encourage bed rest, option B, restrict fluid intake, option C, implement bladder training, option D, insert an indwelling catheter. The right answer is answer C, implement bladder training. Which action should be included in a care plan for a patient with deep vein thrombosis (DVT? Options are option A, encourage early ambulation, option B, perform vigorous leg massage, option C, apply warm compresses, option D, keep the affected legs elevated. The right answer is answer D, keep the affected leg elevated. Which intervention is most appropriate for a patient with diarrhea? Options are encourage a high fiber diet, option D, administer a stool softener, option C, encourage fluid intake, option D, provide dairy rich foods. The right answer is answer C, encourage fluid intake. A patient with a tracheostomy requires suctioning. The nurse should. Options are option A, perform suctioning every hour, option B, use sterile technique, option C, instill normal saline before suctioning, option D, apply continuous suction while inserting the catheter. The right answer is answer B, use sterile technique. What is a major side effect of opioids? Options are option A, hypertension, option B, constipation, option C, hyperactivity, Option D, increased urine output. The right answer is answer B, constipation. Which medication requires monitoring of INR levels? Options are option A, digoxin, option B, warfarin, option C, metformin, option D, aspirin. The right answer is answer B, warfarin. Which electrolyte imbalance is at a risk when using furosemide? Options are option A, hyperkalemia, option B, hypokalemia, option C, hypercalcemia, option D, hyponatremia. The right answer is answer B, hypokalemia. Which medication is commonly used for anaphylaxis? Options are option A, epinephrine, option B, albuterol, option C, diphenhydramine, option D, aspirin. The right answer is answer A, epinephrine. A nurse should monitor for which side effect of morphine? Options are option A, hypertension, option B, hyperglycemia, option C, diarrhea, option D, insomnia. The right answer is answer A, hypertension. What is the primary goal of evidence-based practice? Options are option A, reduce hospital costs, option B, improve patient outcomes, option C, increased workload efficiency, option D, replace traditional methods. The right answer is answer B, improve patient outcomes. Which document guides legal nursing practice? Options are nursing textbooks, option B, hospital policies, option C, Nurse Practice Act, option D, patient chart. The right answer is answer C, Nurse Practice Act. A nurse suspects elder abuse. The best action is to, options are option A, confront the caregiver, option B, report it to the appropriate authority, option C, document findings only, option D, ignore it unless physical injuries are seen. The right answer is answer B, report it to the appropriate authority. Which principle emphasizes doing no harm to the patient? Options are autonomy, option B, beneficence, option C, non-maleficence, option D, justice. The right answer is answer C, non-maleficence. What is the first step in nursing process? Options are option A, planning, option B, assessment, option C, implementation, option D, evaluation. The right answer is answer B, assessment. Which breath sound is most commonly associated with asthma? Options are option A, crackles, option B, stridor, option C, wheezing, option D, pleural rub. The right answer is option C, answer C, wheezing. A patient with left-sided heart failure is most likely to experience. Options are option A, peripheral edema, option B, ascites, option C, pulmonary congestion, option D, jugular vein distension. The right answer is answer B, pulmonary congestion. Which Glasgow Coma Scale (GCS) score indicates a coma? Options are option A 15, option B 12, option C 8 or less, option D 10. The right answer is answer C, 8 or less. Which of the following is an early sign of increased intracranial pressure (ICP)? Options are option B option A bradycardia, option B hypertension, option C restlessness and confusion, option D fixed and dilated pupils. The right answer is answer C, restlessness and confusion. A nurse assessing a dehydrated patient expects to find. Options are option A, bonding pulse, option B, increased blood pressure, option C, poor skin turgor, option D, peripheral edema. The right answer is answer C, poor skin turgor. A patient with anemia is most at risk for which nursing diagnosis? Options are option A, risk for infection, option B, activity intolerance, option C, risk for fluid volume deficit, option D, impaired skin integrity. The right answer is answer B, activity intolerance. Which nursing diagnosis is most appropriate for a patient with a colostomy? Options are option A, risk for aspiration, option B, impaired urinary elimination, option C, disturbed body image, option D, risk for bleeding. The right answer is answer C, disturbed body image. A patient experiencing nausea and vomiting is at risk for options are option A, fluid volume deficit, option B, excess fluid volume, option C, impaired gas exchange, option D, chronic pain. The right answer is answer A, fluid volume deficit. Which nursing diagnosis is most appropriate for a patient with severe pain? Options are option A, ineffective breathing pattern, option B, chronic confusion, option C, acute pain, option D, risk for falls. The right answer is answer C, acute pain. Which nursing diagnosis is most appropriate for a bedridden patient? Options are option A, risk for impaired skin integrity, option B, acute pain, option C, impaired verbal communication, option D, social isolation. The right answer is answer A, risk for skin integrity, impaired skin integrity. What is the priority intervention for a patient having a seizure? Options are option A, restrain the patient, option B, insert a tongue blade, option C, protect the airway, option D, offer fluids. The right answer is answer C, protect the airway. Which intervention is appropriate for a patient with a fever? Options are option A, keep the room warm, option B, offer fluids frequently, option C, restrict movement, option D, administer opioids. The right answer is answer B, offer fluid frequently. Which is the best nursing intervention for preventing deep vein thrombosis? Options are encourage early ambulation, option B, applied cold compresses, option C, limit fluid intake, option D, encourage prolonged bed rest. The right answer is answer A, encourage early ambulation. What is the first action if a patient is choking? Options are option A, call for help, option B, perform Heimlich maneuver, option C, give sips of water, option D, check pulse. The right answer is answer B, perform Heimlich maneuver. Which nursing intervention is appropriate for a patient with pneumonia? Options are encourage deep breathing and coughing. Option B, limit fluid intake. Option C, keep the patient in a supine position. Option D, avoid administering oxygen. The right answer is answer A, encourage deep breathing and coughing. What is the antidote for heparin overdose? Options are option A, vitamin K, option B, Protamine sulfate, option C, naloxone, option D, acetylcysteine. The right answer is answer B, protamine sulfate. A nurse administering insulin should be most concerned about. Options are option A, hyperglycemia, option B, hypoglycemia, option C, hypertension, option D, bradycardia. The right answer is answer B, hypoglycemia. Which medication is commonly used to treat bradycardia? Options are option A, atropine, option B, digoxin, option C, metoprolol, option D, warfarin. The right answer is answer A, atropine. Which of the following is a major side effect of corticosteroids? Options are option A, hypoglycemia, option B, hyperglycemia, option C, hypertension, option D, hyperkalemia. The right answer is answer B, hyperglycemia. Which route of medication administration has the fastest absorption rate? Options are option A, oral, option B, intravenous, option C, intramuscular, option D, subcutaneous. The right answer is answer B, intravenous. Which of the following is a priority for preventing falls in hospitalized patients? Options are option A, keep the bed in the lowest position. Option B, encourage the patient to walk alone. Option C, keep the room dark at night. Option D, restrict fluid intake. The right answer is answer A, keep the bed in the lowest position. A patient receiving a blood transfusion develops chills and fever. What is the nurse's first action? Options are option A, continue the transfusion. Option B, stop the transfusion immediately. Option C, increase the infusion rate. Option D, administer pain medication. The right answer is answer B, stop the transfusion immediately. What is the best nursing action for a patient with a suspected stroke? Options are option A, delay care for 24 hours. Option B, keep the patient flat on the bed. Option C, perform a neurological assessment and call for help. Option D, give the patient aspirin immediately. The right answer is answer C, perform a neurological assessment and call for help. For a patient in shock, the nurse's priority is options are option A, monitor urine output, option B, maintain airway clearance, airway and circulation, option C, administer pain medication, option D, encourage oral fluids. The right answer is answer B, maintain airway and circulation. Which sign is most concerning in a patient with an IV line? Options are slight redness at the insertion site. Option B, pain, swelling, and cold skin around the IV site. Option C, minor bruising near the site. Option D, patient reports mild discomfort. The right answer is answer B, pain, swelling, and cold skin around the IV site. Which of the following is an early sign of hypoxia? Options are option A, cyanosis, option B, restlessness, option C, bradycardia, option D, hypertension. The right answer is answer B, restlessness. What is the normal range of serum sodium levels? Options are 2.5 to 4.5, option B 135 to 145, option C 3.5 to 550, option D 8.5 to 10.5. The right answer is answer B 135 to 145. A nurse assessing a patient with a suspected stroke should prioritize. Options are option A, assessing grip strength, option B, performing a neurological assessment, option C, asking about family history of strokes, option D, checking urine output. The right answer is answer B, performing a neurological assessment. Which nursing diagnosis is most appropriate for a patient with COPD? Options are option A, risk for fluid volume deficit, option B, impaired gas exchange, option C, impaired urinary elimination, option D, chronic confusion. The right answer is answer B, impaired gas exchange. A patient with heart failure has difficulty breathing while lying flat. The best nursing diagnosis is options are option A, ineffective tissue perfusion, option B, activity intolerance, option C, risk for aspiration, option D, ineffective breathing pattern. The right answer is answer D, ineffective breathing pattern. What is the antidote for opioid overdose? Options are option A, acetylcysteine, option B, vitamin K, option C, protamine sulfate, option D, naloxone. The right answer is answer D, naloxone. Which of the following medication is a beta blockers? Options are option A, amlodipine, option B, metoprolol, option C, lisinopril, lisinopril, option D, furosemide. The right answer is option answer B, metoprolol. What is the priority action if a patient has a severe allergic reaction? Options are administer epinephrine, option B, give oral antihistamines, option C, apply a cold compress, option D, monitor for 30 minutes before acting. The right answer is answer A, administer epinephrine. Which of the following is the best intervention for preventing pressure ulcers? Options are option A, reposition the patient every 2 hours. Option B, keep the patient on the bed rest. Option C, reduce protein intake. Option D, avoid using pillows. The right answer is answer A, reposition the patient every 2 hours. Which action is most important for preventing catheter associated urinary tract infections? Options are option A, empty and drainage bag every 8 hours. Option B, change the catheter daily. Option C, perform perineal care regularly. Option D, keep the catheter bag on the bed. The right answer is answer C, perform perineal care regularly.